Hi, we've just got a quick update for you today on Group A Streptococcus, given the recent news about the increased numbers that we're seeing in the UK and the unfortunate fatalities. In this video, we're going to outline what Group A Streptococcus is, the signs to look out for, as well as what to do if you suspect it. Group A Streptococcus is the name given to the bacteria that is sometimes found on the skin or in the throat. Now, for many, they will carry this bacteria harmlessly and it won't cause any symptoms. But occasionally, with close contact, this can be spread to other patients that may be more susceptible to getting the infection. We don't know why in some people it causes symptoms while others it doesn't, but it's believed to be by the bacteria getting through the natural physical barriers that are present to block infection. The symptoms experienced in a Group A strep infection vary because it really depends on where the infection is happening. Skin infections are common, and cellulitis, which would cause redness, warm skin that often is breaking down, can be common. You can also get impetigo. This is a skin infection that can happen in all ages, but most commonly younger people, where you'll get red inflamed skin, but often with a golden crust appearance on the surface. Now, these infections, if mild, can resolve on their own or with the assistance of antibiotics. Group A strep can also cause throat infections and occasionally a particular type of throat infection, which we call scarlet fever. Scarlet fever is an infection that leads to a few characteristic symptoms. One is what we call a strawberry tongue, so that's a red, dimpled tongue, and also a rough sandpaper-like rash, which looks different depending on your skin tone. The darker skin colours, you may get a pale or purple appearance to it, while lighter skin colours are going to see a pink or purple rash. But for both, it's often got that rough sandpaper feel to it. Now, if you experience any of these symptoms, it's important to speak to one of the team in order to ensure that where needed, the right treatments are issued at an earlier stage. Some people in our community will be at increased risk of developing more severe Group A Streptococcus infections. Those include, but it's not an exhaustive list, people that have been in close contact with someone with known Group A strep, if you have diabetes, heart disease, or cancer, people with HIV, those who have recently had a chickenpox infection, as well as people taking immunosuppressant medications, so medicines that reduce our immune system, like cancer treatments and steroids. There's been a lot in the news recently due to the unfortunate deaths that we've seen due to Group A strep. It's really important to bear in mind that this is rare. The vast majority of people that have Group A strep will have a full resolution of symptoms. But what we want to do is make sure you're aware of the key symptoms to look for in invasive Group A strep. Now, any one of the following, it's important to seek prompt medical advice and review. One is a fever, so that's a temperature above 38 degrees centigrade or 100.4 Fahrenheit. Severe muscle aches. Thirdly, we've got localized muscle tenderness. And finally, redness at the site of a wound. As I said before, if you experience any of these symptoms, it's important you seek prompt medical review.